Hi, and welcome to Common Knowledge Trust's Birth Coach online birthing class. I've been very privileged in my life in the 50 years I've spent involved in the childbirth conversation because the skills in this course and all of the other courses in Birthing Better were developed equally by fathers like yourself and mothers like myself. We did it over a 15-year period. We, as women, wanted our husbands, because then we were pretty much married, to come to birth with us to help us cope and manage. We didn't think about whether you guys could help reduce or prevent any risks from becoming problems, nor did we even really think about the impact of pregnancy on fathers. My, how times have changed. You who are listening to this may be a sister, a mother, a friend, or a female partner. We're going to use the term father as birth coach because it is easier to do that, not because we have a political agenda here. So, what is this course about? This course is sharing with all of you who are going to be the birth coach the skills that fathers and mothers developed around this important task. We as women are the only ones giving birth, no matter how our birth unfolds, where we birth, who's present, what our beliefs are, what our choices are, whether we lack choices or our choices change, we have to do it. If there are 100 people in the room, we are the only person doing the birth. So women always are birthing alone. So we as women need the skills so that we can cope and manage well and feel in control. If we lack skills, we can suffer or feel overwhelmed. Your job as a father and a birth coach is to help us cope and manage. We will get into how you can help reduce or prevent issues from becoming problems later on in this course. So you already know something. Divide birth into two areas. Coping, which has nothing to do with a medical problem. So when women experience pain in labor, there is usually not a problem. And if you have a doubt about it, ask your birth professionals, is this a problem? And if they say no, then you know that the pain and discomfort that she is feeling is part of the normal, natural, physiological pain of labor contractions. This is also true if you have a non-laboring cesarean or an emergency or an unplanned cesarean. If you have questions, ask your birth professional. So now one element is coping. Help us cope and manage and stay on top of what's happening to or around us. The second issue is trying to prevent or reduce risks from becoming problems. There is no general risk in childbirth. If a woman is not pregnant with twins, she does not have a twin risk. If she has preeclampsia, she has a preeclampsia risk. That might be compounded by other risk factors. Can skills prevent or reduce risks from becoming problems? Because risks are only a wake-up call. Problems can come from risks that are identified or not identified that happen, but they don't usually happen in the blink of an eye. There's something beforehand that's implying that a risk is developing. And a problem doesn't mean death or severe injury. It just means a problem. It means that it has to be dealt with. So yes, when we developed the Birthing Better skills, the hundreds of mothers and fathers who did this in the 70s and the 80s, we focused first on the coping and managing, because back then 95% of us were laboring and giving birth vaginally because the medical profession was not as sophisticated as it is now. And we birthed whether we had risks or not, whether we coped or suffered. whether birth was easy or difficult, whether it was short or went on for days, and whether risks became problems or not, and whether problems became death or serious injury or resolved themselves. So we focused first on coping, and then we realized that many of us were still having long first stages, dilation, and second stages, delivery, and the medical profession tended to want to help. They want to help reduce the suffering, so they give us pain relief, and they want to reduce the risk from becoming problems. So they do more assessments, monitoring, and procedures, which are now called interventions. So we then focused on preparing the body for birth. You have the same body that I have. We talk the same language once you have the skills. Then fathers did something incredibly unique, and that is to realize that at 24 weeks, when we advocate that you start to prepare the body for birth, is that 6 months into pregnancy, men already feel left behind. So they developed the 10 skills to develop during pregnancy. And they realized that there were 5 quite unique phases of pregnancy: conception to 12 weeks, 12 weeks to 24 weeks, 24 weeks to 36 weeks, 36 weeks to the birth, and birth, because women, are still pregnant until our baby is out of our body. So those 10 skills are available to you as well. They get applied to you, and they change in each of these 5 phases of pregnancy, and they get applied to the baby's mother, and they get applied to the baby. Sometimes one of or more of those skills is a high need of being used. At other times, it's in the background. At least you have them. You're a human being. I'm a human being. You thrive on being skilled. I thrive on being skilled. We like to use skills together. It's called teamwork. You want to be skilled for your job as a birth coach. I want to be skilled as my job as the birthing woman. This is teamwork. So when you go through the skills in this lesson, if you want your partner to be involved, involve her. If you don't want her involved, totally up to you. When you get to the body skills, have her do them on you first, so that you feel in your body what you're trying to achieve in her body. When it comes to the internal work and preparing a woman's vagina, 90% of fathers, once they learn this skill, happily do it 5 minutes a day for 8 weeks. It does several things. It helps you understand and do something to help a big object come down through and out a woman's body without damage to her body or to your baby. So let's get stuck in now, and you will gain huge skills in doing this. Your job is to practice them a little bit, and we'll explain how, and then to use them no matter where your birth occurs. Honestly, nobody is going to stop you from helping the birthing woman stay in control. That's your job, and you need to do it really well. And she will be forever grateful, ever grateful, ever grateful. And she will trust you with the baby after birth.